Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. This is a 6-year-old Chihuahua with acute vomiting, diarrhea, and hematochezia. Once you have reviewed the radiographs using a systematic approach, then you're ready to watch this video. Now, although this is a patient with gastrointestinal signs, I would like to use this as a chance to talk about assessing liver size on radiographs. I like to assess liver size relative to the position of the costal arch. I'm pointing to the costal arch here. The costal arch is a mineralized structure that joins the ventral aspect or distal aspect of the ribs with the sternum. I say it's mineralized because we can see it on the radiographs in this patient. In young patients, it is often not mineralized, and because it's made of cartilage, it may not be apparent radiographically, presenting as a soft tissue opacity. In any case, when we can see the costal arch, as in this case, it allows us to assess the liver position. I see the margin of the liver being somewhere in this region here. I expect the liver to go more cranially, in line with the costal arch. The position of the costal arch and the position of the liver relative to the costal arch can vary a lot with breed and conformation, but this is one of the criteria that we can use. Another criteria that can be useful, which you may have heard mentioned, is the position of the gastric axis. I'd like to illustrate what we mean when we say gastric axis. I'm drawing a blue line to show you approximately where I would place the gastric axis in this patient. We're essentially referring to the line that follows the gastric body on the lateral radiograph. The normal gastric axis in dogs has been described as being either parallel to the ribs or perpendicular to the vertebral column. So a line something like this would probably be the expected normal gastric axis in this patient. So in this case, it's fair to say that there's cranial displacement of the gastric axis because instead of the line being in line with our orange line, it's more cranial where our blue line is located. Because the liver is positioned cranial to the stomach, pathology that causes the liver to become enlarged will displace the gastric axis caudally like this. In those cases, we may appreciate caudal displacement of the gastric axis on the lateral radiographs. Now, since this patient presented for gastrointestinal signs, I will mention quickly that what I see from gastrointestinal perspective is a lack of feces in the colon. Rather, I see fluid and gas, a small amount of feces only in the ascending colon, and otherwise the small intestine and stomach have relatively normal size without evidence of foreign material or obstruction. So I would conclude for this case that there's suspect small liver, which needs to be correlated with clinical findings. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.